Hi everyone, my name is Lauren Taylor, and the vulnerable population that I chose is individuals with autism. And this population is vulnerable because this disability can affect speech, nonverbal communication, social skills, and repetitive behavior. Due to these disabilities, this predisposes autistic individuals to harm out in the world. Um, in recent years, there have been more shows and movies that depict a autistic individual. And a lot of times in the media, many autistic individuals are portrayed to be a genius or, in other terms, a savant. You'll hear that pretty frequently for autistic individuals. So it comes off very exaggerated and that all autistic people are savants, when 10% of the autistic population are savants, and there are so many people that range on the spectrum of autism. This puts this population at risk because if the media depicts autistic individuals as geniuses, it can make it seem as though all autistic people are savants or extremely smart, and this misinforms the public, and the assumption that all autistic people are geniuses is there, leaving this population to be misunderstood and the public to assume that they know how to interact with these people when each person with autism is so different. So a recent study analyzed a little under 200 people, and they watched these people with autism for 20 years. And so it started in, I believe, 2000. And at the end of the study, 99% of the people that they analyzed over the 20 years did not live independently. 70% of them lived at home with family. 21% lived within a disability home, and another 8% lived in a different type of community housing. So going off of this study, it shows how crucial family support can be for this population. As previously discussed, autistic individuals have varying functionality. Some individuals are unable to complete activities of daily living independently, such as cooking, dressing, or personal hygiene. And other individuals are unable to communicate effectively. So family support is crucial to help individuals function daily and ensure their safety. Family can also assist in making sure the autistic individual is getting the treatment they need, whether that's different types of therapy or medication that's prescribed to help manage the autism. The role of peers for autistic individuals is also very important. Many individuals who are autistic struggle creating friendships or socializing with others, and it can be hard for individuals to engage in conversation and find it very overwhelming. By learning to socialize with others, autistic individuals can connect with others with similar experiences and have someone to relate to. This is a good example of how the role of peers can be supportive effect on an autistic person's life. Another thing to mention is building friendships, but it benefits an individual by boosting self-worth and confidence. For many autistic people, socializing can be scary, but by socializing regularly with peers, it can reduce social anxieties. According to several studies, the autistic population has a high incidence of self-harm and suicide. This is due to autistic people feeling very frustrated about communicating with others, as well as processing one's own thoughts, and just all the stress that comes with being autistic. It also is due to autistic individuals unable to process one's emotions very well. The cause of autism is not fully understood, but there is a pattern of autism occurring in increased maternal age, preterm birth, low birth weight, and pregnancies that have multiples, such as twins or triplets. So looking at these two examples, there are cyclical natures within autism, both with an increased rate of suicide and the effects of being born early or increased maternal age. The legal and political system. In the last few decades, there has been much advocacy work for individuals with disabilities, which includes autistic individuals. In 1990, the Americans with Disabilities Act was passed through legislation to ensure there is not discrimination to individuals with any type of disability. The Individuals with Disabilities Education Act was also passed to ensure individuals with disabilities have the right to free education. The protection of advocacy systems is a network created to help individuals with disabilities in regarding any legal matters that they need assistance with. And lastly, individuals who are disabled can receive supplemental security income who are unable to work or have limited abilities to work. So these are all resources and acts and policies that have been passed in favor of individuals with autism. So this section goes along with other health disparities that we'll continue to talk about. But as far as cultural factors that might make this population more vulnerable, behaviors of autistic people can prevent them from engaging in religious activities. In a lot of religions, there's prayer and times of meditation, and this might make it really hard for autistic individuals to participate in these types of activities. Autistic screenings originated in North America and Europe, and so studies have found that other countries around the world have had a lot of undiagnosed people. So this is a potential barrier if someone is not diagnosed early enough to receive treatment and to get the assistance they need and to be able to carry out activities of daily living. And then lastly, in some cultures, adults and children are all expected to act a certain way, to be polite and respectful. And not saying that autistic people aren't, but sometimes the way they communicate is not accepted in some cultures. In one study, it found that individuals with autism in Asian cultures really struggle because their elders expect them to act a certain way, and sometimes they don't fit that mold. Moving on to health disparities and the effect that socioeconomical status can have on individuals with autism. This particular study that I found that cultural minorities have less access to care to diagnose autism. And this is due to socioeconomical challenges. A lot of the people that they found this lived below the poverty rate, and their children or as an adult, they went undiagnosed for years. There's also issues with understanding the diagnosis. Sometimes if someone doesn't have access to care in their primary language, there can be a misunderstanding of what exactly the diagnosis is and what treatment is. And then lastly, in this study, it saw that cultural minorities had issues adhering to the treatment plans that doctors had to carry out, and that might go along with the misunderstanding of the diagnosis and the treatment. Because individuals who have socioeconomical challenges, this results in people getting diagnosed later in life, which just prolongs treatment or therapy, which puts this population at risk because they're not getting the help or assistance that they need. Race and ethnicity. The CDC reported that white individuals, whether they're children or adults, are more commonly diagnosed than other races, such as Hispanic or individuals who are Black. And this is another issue because then more people are just undiagnosed and not getting the treatment that they need, which goes along with the socioeconomical challenges. And the CDC also found that other races don't have the same access to health care, and this might be due to people not being citizens of the United States, low income, and education. Next, religion. Religion can be a great place for some people, and it can be also detrimental to other people. On the positive side of things, religion often creates a place for people to get to know one another and socialize over common beliefs. For autistic people who attend church, or whatever religion that they participate in, they find hope and reassurance that everything will be okay, and they have a support system, not only for the individual, but the family with the autistic family member, whether that's a child or an adult child. And then it also brings a sense of belonging, which a lot of autistic people have said they don't feel like they belong, or they just don't know where they fit in because they just feel different. Religion can also be a place of resentment for people, such as questions: if there is a higher being, why did this happen to me? Why am I struggling with this? Why me? As far as health disparities with gender, looking at another study that I found, females tend to be less diagnosed or undiagnosed compared to males in the autistic populations. In the autistic population, it's about 4-to-1 ratio. So for every 4 males, there's 1 autistic female. And this also goes back to people getting diagnosed at later ages, which they miss out on treatment or help. Studies suggest that it's harder to diagnose females due to a variety of things, but they found that autistic females tend to still be more social compared to males with autism. And females are more self-aware than males, and so when they do the screening, sometimes it gets a little confusing for to diagnose a woman or not, or a female or not, and so that's why there's health disparities within gender. In looking at geographical location, socioeconomical areas tend to have less access to health care. So this means lack of treatment or therapy needed for one's autism, and this could be due to distance of treatment centers or accessibility due to if they have insurance or not, and the treatment can be expensive. Also, the United States and Europe do more screenings than other countries, so people who live in these other countries that don't do screenings might not get the assistance they need to treat their autism. And lastly, telehealth can be a great utilization for individuals who are autistic because some of them struggle socially. So in doing telehealth or telemedicine, they can stay in their homes and not have those anxieties about going out in public. Lastly, in talking about biases, a study was conducted and neurotypical adults participated, meaning just people without autism, on what their perception of autism was. And the results found after a series of surveys that participants had negative implicit biases, but positive explicit biases. So their first reaction to seeing words on the screen, such as good or bad, normal, autistic, they had negative implicit biases. And when they saw things that actually said, like autistic people should be able to get married, or I'm very friendly to autistic people, they had positive explicit biases.